Use of narcotics as a way to alleviate pain has been used throughout all of history. In the 16th century, opium poppy was mixed with alcohol and used as a painkiller. The use of actual opioids began in the 1800s. A German scientist named Friedrich Saturner discovered a way to isolate a substance from opium. He named his substance morphine. Opiates were used to treat pain and anxiety. When he first made his discovery, it was believed that opiates and morphine were non-addictive. Morphine became widely used during the Civil War. Doctors of both the Union and Confederate armies prescribed morphine to soldiers. It was used to ease the pain of these wounded soldiers. Many of them were not aware of the addictive power of morphine. Morphine was originally deemed as a wonder drug. The Union Army issued more than 10 million doses of morphine during the war. It was estimated that between 200 and 500,000 soldiers in the Civil War became addicted to morphine. Their addiction was commonly referred to as the soldier's disease. Due to the addictive nature that was discovered in the Civil War, in later wars, there was other methods used to treat soldiers. During the Second World War, a syringe, which is a small tube of morphine attached to a hypodermic needle, was used. Because they knew the addictive nature of morphine, medics were instructed if the syringe was used on a soldier, they were to then pin it to the collar of the soldier so other medics would know that that soldier had already been given morphine. Currently, morphine is not carried by the medics in the U.S. military. Medical staff have learned that morphine is very addictive. As a way to try to create and stop issues of the morphine addiction, heroin was synthesized as a substitute. Again, heroin was labeled just like morphine as non-addictive. It did not take long for medical personnel to discover that heroin was also addictive. To try to combat the addictive nature of heroin, oxycodone was developed in the early 1900s. It was also later discovered that oxycodone was addictive. Drug addicts were able to alter the oxycodone to either snort, they would crush them and snort them. When oxycodone is crushed and snorted, it negates all the safeguards that the manufacturers put into place. In the early 2000s, OxyContin was manufactured. OxyContin was also deemed to be non-addictive. However, drug addicts were also able to find ways to alter OxyContin tablets. Abuse of opioids in the U.S. has set a record level high. Currently, right now, just in the state of West Virginia, the overdose death rate have increased by 550% and is the highest in the nation. Fatal drug overdoses are the #1 cause of death for people under the age of 45. Surprisingly, drug abuse is found more in rural areas than in urban areas. A large reason for this is social issues that are found in rural areas, such as poverty, poor health status, high unemployment rates, limited educational attainment, inadequate mental health facilities, geographic isolation, and lack of health insurance. Drug use in rural West Virginia has always been related to the physically demanding jobs. Jobs in West Virginia have been with coal mining and logging, which can cause back pain and severe injuries. This has led to prescriptions for pain, which has led to a misuse of the pain medication and an addiction to opioids. In the rural areas of West Virginia, there is a severe lack of resources for drug addicts. Part of the reason for this is there is a lack of resources, access to adequate care facilities, there are fewer medical facilities and fewer providers, and there is no detox services in the majority of rural West Virginia. 82% of rural residents live in communities that offer no detox services. There are typically no residential inpatient or extensive outpatient care in the surrounding rural areas. The distance patients need to travel to seek help is often a barrier to treatment. The travel times for the treatment do cause lower completion rates of services. In West Virginia, there is more than 152,000 people seeking substance abuse treatment, according to the West Virginia Department of Health and Human Resources Behavioral and Mental Health Bureau. They also state that there are only 849 drug rehabilitation beds throughout the entire state. Of those beds, only 180 are for detox services. 128 of the beds require the patient to have a pre-existing mental health issue, and 541 of the beds are available for traditional rehabilitation services. Due to the lack of available rehabilitation services, those seeking help often do not get the assistance they need. Most of us here in West Virginia are familiar with the incident in Huntington, West Virginia in August of 2016. 28 people overdosed in a 5-hour time frame on heroin. Of the 28 people, 2 did die. 1 died at the hospital and 1 was found dead later in his home. Of the 26 surviving, only 6 requested help. One of them was a young woman named Taylor Wilson. Taylor and her family requested medical assistance upon her release from the ER after her overdose. There was no open bed for Taylor to have. On September 25, 2016, Taylor died from a fatal drug overdose before she was able to get the help. 3 days after Taylor's death, her mother received a phone call that a rehabilitation bed had been found for Taylor. Medication-assisted treatment is one of the best evidence-based treatments available for opioid addiction. MAT involves using either methadone, buprenorphine, or naltrexone for treatment. The 3 FDA-approved medications are used along with counseling and behavior therapies. These medications reduce and eliminate withdrawal symptoms, reduce psychological cravings, and have no adverse effects on mental capability, and have no effect on physical functioning. For our group program concept, we designed a program which uses the 33-day reporting DRC centers in the state of West Virginia. Currently, DRC centers are used, and they are a diversion program for adults who are charged with felonies and misdemeanors who have a history of substance abuse or dependency. The DRC's current program reduces the number of offenders who are sent to jails by having the offenders go to the DRC in lieu of jail. The DRC provides offenders with a program that, depending on the specific DRC in which county, can run 6 to 12 months. For our program, we have elected to have the 33 DRCs in the state of West Virginia apply to become certified opiate treatment programs. By becoming certified opiate treatment program centers, more clients would have the opportunity to use the proven method of MAT treatment for substance abusers. This will reduce the number of residents who are waiting for treatment by adding 33 new treatment centers to the state. It will also reduce the travel time for patients who currently are traveling to MAT centers located outside of the state. It will help those with addiction problems to reduce the cost associated with treatment and may relieve some of the stressors that frequently causes relapses. By allowing residents who need services in rural areas the ability to use local DRCs instead of just criminal offenders, the DRC program could potentially become an outreach center for those in need of drug treatment. After they have completed the program at the DRC and are no longer in need of daily or weekly treatment, a monthly treatment meeting would be established with the therapist to touch base. This monthly meeting would also be helpful to prevent relapses and for the therapist to monitor the MAT medications.